schedule and respect your time. Hi, I'm Caitlin, by the way. I'm here at ADHS. I'm one of the foodborne EPIs. So we'll go ahead and do a little bit of housekeeping, and then we'll get into some introductions. If you guys could please mute yourself when you are not speaking, that would be fantastic and would really help with some background noise. Definitely take your time, get used to this interface. I know there's a couple different ways you can view each other. You can either have it on the speaker view, or there's a gallery view so you can see everyone. Sometimes you can just put it on yourself if you really just want to see what you look like. I personally don't like that view. I find I look a little goofy sometimes. You can use the chat box to either get in touch with any of us here at ADHS or Ashley. She's doing tech support for us. So if you have any questions, please feel free to use that. Or you can just use your body language, raise your hand, and we have people here keeping an eye out for that if you have a question or need assistance with anything. So we'll go ahead and get started. I know this is a little bit different than a conference call. So we're asking that you guys participate for at least 3 out of the 4 sessions. We really want to see you guys every week and hear your experiences, and we hope that we can share some great information with you. We are recording these sessions, so they will be available to anyone via email, and you guys are more than welcome to share them throughout your county or with whoever you think would be a great audience for this. So our sessions will consist of a presentation that is planned by one of us here at ADHS, and then we'll have a case investigation summary. Hopefully, I know I've received a few case investigation forms. If you guys could please fill out your forms and get them to us sooner than later, that would be really helpful. We really want to hear about your guys' experiences and learn some of your own personal techniques that you guys use when you're doing investigations. And I know it might seem a little odd, but we're going to do introductions every week. It helps us get familiar with each other and build a great community. So I'll start. Again, if you could just say your name, where you are, your title, and then our icebreaker question today is, what compliment do people give you the most? So again, my name's Caitlin. I'm here at ADHS. I'm one of the foodborne EPIs. I think one of the compliments I get most is probably in regards to my smile. Everyone seems to like it, so hopefully you guys get to look at that and don't think it's too painful. So I'm just going to go around and call out the names that I see in order on my screen. It might be a little bit different on your guys' screen. But Debbie, do you want to go ahead and introduce yourself to the group?
Okay, can you hear me?
Yes, ma'am.
My name's...
Hey, Debbie, we can't see you, but we can hear you. Is there a way to adjust your camera?
Oh my, let's see.
There we go. That's coming in.
I'm working on it.
Well, maybe if you guys just, oh, there it is. Maybe if you want to just introduce yourself and then you can fiddle with it.
Okay, my name's Debbie Williams. I'm a public health nurse here at Mojave County. What else do you want to know? I don't know about compliments. I'm a little bit shy. So maybe I'm just a nice person. That's what people say.
That is fantastic. A great compliment to receive.
Well, thank you.
All right, Marilee, do you want to introduce yourself?
Hi, everyone. I'm Mary Lee Kellis. I'm the outbreak epidemiologist working on the food team here at ADHS. And a compliment that I've heard here at work is that I'm very polite and nice on the phone, which may not be true in other settings, but I do try to be polite, so I'll take it.
And Marilee is polite in all facets, not just on the phone. And the next I see is Maricopa County, but I see a couple of you guys in the room. So if you just want to unmute yourself and introduce who you have. Maricopa, if you guys are talking, we definitely can't hear you.
Hi.
There
Sorry.
we go.
Can they hear us now?
We can hear you a little bit, yeah.
My name is Katie. I'm one of the surveillance nurses here at Maricopa County, and I'm told I giggle a lot. And my name is Anna, and I'm a CDI here at Maricopa County, and I am told that I have nice hair.
Fantastic. Thanks, ladies. So next I have, and I'm sorry if I completely mispronounce your name. Is it Siona?
Can you hear me?
I can, yes.
Oh, good. I wasn't sure if you could hear me or not. I'm the Director of Public Health Nursing here at San Jose Medical Center in Fort Defiance. And I guess what people usually tell me is I'm friendly and compassionate.
That's fantastic. I find that's what we need in our line of work. Thank you. Yuma County.
Hi, good morning. My name is Alicia Gonzalez. I'm one of the public health nurses here at the health department. And well, one compliment, Rachel has told me that I have a lot of patience when I'm doing the investigations, when I have those patients that talk a lot. So
Yeah, that's definitely a talent to have, or a skill to have.
My name is Mireya Lopez. I'm a new employee, and I guess one compliment is willing to learn. That's why I'm here.
Fantastic. We're really glad to have you.
This is me. Oh, you can move it out. This is Benito, so I'm the EP, so I'll be in and out. So I'm so happy to participate in this meeting. So one of the compliments is I'm always willing to do something additional when we need to do investigations.
Fantastic. Thank you, guys. And I see a room full of people in what I believe is Coconina County. Do you guys want to introduce yourself? If you ladies are talking, we definitely can't hear you. Maybe try unmuting yourself.
I think when you're using a phone, you have to unmute yourself on the computer, but also on your phone. But I'm using my phone.
We can hear you.
Just like if you're using a phone, you don't have to mute your phone. You can just mute your computer if that's easier.
Oh.
Then you don't have to unmute two things.
Can you all see us too? We're having some technical difficulties.
Yes, we can see and hear you.
Perfect. Well, I'm Jonica, and I work for Coconino County. I'm on the communicable disease team. I assist Matt with epidemiology, and then I also work in STD control with Celia and Mary Ellen.
Yeah, and I'm Celia. I'm the CDC Public Health Associate and the Communicable Disease Associate here at the county. The compliment I usually get is that I'm very friendly. Yeah, that's my compliment.
Jonica, what's your compliment? I get the smile compliment as well, Caitlin.
Awesome. We have that in common.
Hi, everyone. I'm Mary Ellen. I'm the nurse, and I manage the communicable disease TB and STD programs for Coconino County. And I guess the biggest compliment that I hear is that I'm very helpful and very knowledgeable, because I've been here forever.
Well, thank you, ladies. Lisa?
Can you hear me?
We can.
Good morning. I'm Lisa. I'm a public health nurse with Mojave County Health Department in Kingman. And probably the biggest compliment I get is how adorable my grandkids are.
How fun. Well, maybe you can show us pictures if we have extra time later.
Okay.
Brenna.
Yep, there we go. Okay. Hi, I'm Brenda Garrett, the Waterborne Disease Coordinator, and also help out with food stuff here at ADHS. The compliment I get the most is how nice my eyebrows are. That's my favorite compliment, actually. So there you go.
Thanks, Brenda. Very nice. Nick, do you want to go ahead and introduce yourself?
Yeah, can you hear me?
Yep.
Awesome. I'm Nick Schweers. I'm the General CDI Investigator for Pinal County. I guess the compliment that I get around here is that I'm really good at making pretty reports.
Okay, and I'm sure we all appreciate that. Erica, do you want to go ahead and introduce yourself?
Hi, I am Erica Barrett. I work at the University of Arizona as the SAFER lab manager. So we help Maricopa County with the enteric disease investigations. And the compliment I receive from coworkers is that I'm patient and really nice. So.
Fantastic. Thank you. Mackenzie?
Hi, I'm Mackenzie. I'm also a foodborne epi here at ADHS. And I receive compliments on my smile as well.
Lots of nice smiles around here. Demetria?
Hi, my name is Demetria Carr, and I'm a public health student at U of A. Also, I'm the teacher's assistant for the SAFER program at U of A. And the compliment, I guess my hair, it's always different. Right now it's in braids and purple, and I'm always doing something with it.
How fun. That's awesome. Jenny, do you want to go ahead and introduce yourself?
Hello, everyone. My name is Jenny Dela Cruz, and I'm a communicable disease investigator for the state and for Maricopa County. And one compliment I get here at work is that I'm very patient and also that I'm always willing to help. I can relate to the other person who said, you know, they're patient with the chatty cases, and I've been told that that's something I do really well as well. Yeah, just being patient and always willing to help.
I can definitely attest to that one. Martha, do you want to go ahead and introduce yourself?
Yeah, so Martha here. I am the epidemiologist for Cochise County Health Department, and a compliment that I get mostly from my family is that I'm pretty loving.
Thank you. It looks like we have somebody on the phone. Is that Coconino County calling in, or do we have another participant on the phone who doesn't have video?
Hi, this is Edwin from Navajo County, epidemiologist. Can you hear me?
Yes, we can. Sorry, Edwin,
Great.
I saw the 928 number.
Oh, no worries. Yeah, we're all up here in the greater 928 area. So I'm the epi for Navajo County. I do a couple of morbidities as far as the enterics here with our public health nurses. And I guess for comments that I get would be, besides my awesome looks and my chiseled body, I also get comments for using my silliness into explaining certain things. So
well, thank you very much. We all appreciate that. And Ashley, do you want to go ahead and introduce yourself to the group?
Sure. Hello, everyone. My name is Ashley Rankin, serving as your tech support for these calls. And a compliment that I often receive is that I also have a nice smile like Caitlin, and that I'm a good listener.
Thank you. Well, with introductions taken care of, we'll just go ahead and jump into today's presentation. Just a quick reminder to go ahead and mute yourself if you aren't talking, and we will turn it over to Mary Lee.
Okay, I'm so pleased with the turnout so far today. I think we have 18 registrants, and I think we have about 16 or 15 or 16 of us here. So this is fantastic, and I hope that you'll come back the next 3 weeks and that it's really useful. Our intent is for this to be a practical, useful training and open discussion that you can use starting today. I thought you might be interested to hear a little bit about who's here. Like I said, we have 18 people who registered. Most people are from a county health department. We do have people from, some other areas. And most people are public health nurses, but we do have some communicable disease investigators, EPIs, and others. And most of you told us that, that investigating enteric diseases is a primary responsibility for your job. Most people investigate about 0 to 1 cases in the past 4 weeks. So, which is a reflection on small jurisdictions. Even if this is a primary responsibility for your job, it's not high enteric season, and sometimes we're in small areas where there's not a lot. So we're excited to have people from lots of different areas, from all of our state, different time zones, because Navajo Nation observes daylight savings and the rest of Arizona doesn't. And we're excited to have people with different levels of experience, different numbers of years of experience. I think I wanted to highlight that as well. Well, I don't see it real quick how long people have been in public health. So I was going to mention that. Okay, so today our topic is on sensitive occupations and exclusion criteria. We're going to talk a little bit about what we do as enteric disease investigators when it comes to sensitive occupations and excluding folks from work. Other topic areas, we're going to talk about rare disease spotlight. We're going to do a how-to for special exposures, and we're going to do a food history 201, which is a step up from our basic food history guidelines and suggestions and ideas. So today I want to talk a little bit about why we do enteric disease investigation. There's lots of reasons. One of the reasons is we want to just let the person know that they were diagnosed. A lot of us find that the doctor never notified the patient of their positive lab result, and that the person just never even knew. So that's one of the reasons why we follow up with enteric diseases and do this investigation. Another reason is to identify some risk factors of maybe some behaviors or exposures they might have had that might be contributing to their illness. We wouldn't necessarily be able to say for sure that's how they got sick based on one interview, but we do know that people drinking raw milk, for example, are more likely to get these illnesses. So, we may identify some of these common risk factors: exposure to, live poultry, eating undercooked eggs or meat, those sorts of things. We're going to identify some risk factors, and then we're going to provide education. So we're going to help these people that we're interviewing know some information about how to prevent from getting sick in the future. We also want to prevent secondary spread, so we're going to give them education about how they can prevent spreading their illness to other people. And another reason why we do these disease case investigations is to identify outbreaks. As we get this exposure history, we're going to identify some exposures they might have had that someone else with the same strain of this illness may have also had. But today we're going to focus on the part of the disease investigation where we're going to be identifying sensitive occupations that we are concerned they may be at risk for spreading the disease to other people. And I want to kind of talk through a couple of steps for doing this work of identifying sensitive occupations and responding to that. So step one is identify. So what we want to do is ask questions about what these people, what the case patient does for work, or if it's a child, where the person attends school. On our current forms, we ask about basically 3 sensitive occupations. We ask about whether or not they are a food handler, whether or not they attend or work in childcare, and then also whether or not they work in patient care. patient or resident care, which would expand that not just in a hospital, but also, in a residential treatment facility or in a long-term care facility. So that's the way it is right now on our current form. However, it's a good idea to go ahead and ask just about occupations in general. You can ask, what do you do for work? You can just ask that in a very broad way. And then as they're telling you about that work, sometimes it's really straightforward. You can tell it's an office job. They don't have any of those sensitive occupations. But you may be able to drill down and understand, this person may have worked in a food handling sort of setting. Maybe they generally don't work in food handling, but they sometimes do have interaction with food. Also, in this moment where you're asking about what they do for work, you can ask questions about whether or not they volunteer for work. Do you volunteer in any other settings? Someone might have a volunteer opportunity where they help out with a luncheon, for something that isn't a regular business that they do or a regular job, but something that they would have come in contact with food that was prepared for others. Another situation is maybe they volunteer for childcare. Maybe at their church there's a nursery or somewhere where little children in diapers or toddlers might be. That would fit this sensitive occupation. And there's other ways that we can just be asking, making sure that we're asking about this in depth. So that's step one, is identify. Step two is determine. So we want to determine if the person worked while they were infectious. So this is where it's going to be really important to get a really good onset date for illness and then understand the disease. Every disease is going to have a different exposure period when the person would have come in contact with the illness. It'll have a different infectious period of when they could spread the disease to others. So we want to really understand that really well and get a really good onset date the best we can to determine if the person worked while they were infectious. So step one is identify, asking really good questions that help us identify any sensitive occupations, either in a work or volunteer. Number two, determine, using our information we have about the disease and getting a really good onset date. And then step three is respond. So if we determine that they worked while they were ill, we need to take some action about that. We're going to come back to that here in a minute. So step three is respond. Step four is to exclude. So what we're going to do is ask them not to work in that sensitive occupation for a set number a set amount of time, so that they won't spread it to others. We'll talk about that here more in a second. And step five is going to be to educate. So provide education about how they can prevent spreading this illness in that setting, in that volunteer or work setting, that sensitive occupation. Okay, so I want to pause here for a second, see if there's any thoughts or comments or questions about those 5 steps for sensitive occupations.
I have a question. We once interviewed a case that worked at a facility that prepped chicken for production, so before it goes to the grocery store. And there was a lot of talk about whether it was a sensitive occupation or not, and ultimately it was decided that. But do you have any other, weird occupations that would be considered a sensitive occupation?
That's a good example of one. Does anybody else have any other? Oh wait, so Erica, you guys decided that it was not a sensitive occupation?
That it was, yeah.
Oh, that it was the sensitive occupation. Okay. Can you talk us through about how you decided that was going to be a sensitive occupation and what you guys did about it?
Yeah, well, we just our job is to notify Maricopa County about it, so they ultimately made the decision about whether it was, but I think it was something came down to where they were in the process. They weren't in the culling of the chickens. They were near the end where they were preparing different pieces of the chicken for packaging, and they were working while they were ill, and so they might have transferred it at that point before it got frozen, that kind of thing. So at one point they had worked in the cleaning part of the facility, so just like cleaning the floors and and that was fine. But the specifically like packaging the chicken and touching it, even though they were wearing PPE, yeah.
Okay. So they worked in that facility while they were ill, and there was a risk for contaminating a product that would go into some other place. So,
yeah.
Does anybody else have any examples of kind of difficult to determine? Is this a sensitive occupation? Do we need to do something about it? Okay. That's a good example. Thanks for bringing it up, Erica. I want to share with you now. Oh, actually, okay. So what do we have to do if someone is a food handler? If someone does work at or attend childcare, and if someone does work in healthcare? Well, the good news is that it's all spelled out for us in this lovely document here. You might see it backwards. On my screen, it's backwards, but it's the Arizona Administrative Code. Yay! See all my tabs? This is fun. And I say that a little bit sarcastically, but also it's really nice to be able to have this all set. And it's also quite difficult to flip through this.
Oh, we wanted to add one. Sorry to interrupt.
Yeah. Yeah, go ahead.
Since we're like a really big agricultural, community, we were saying when there's patients that are like in packing, like, they just pack. So that would be another, sensitive one. But, they don't have like complete direct contact, but, they're still kind of like handling and, so.
Yeah. That's a really good example too that I know comes up a lot in Yuma County. Field workers, people that are helping with packing, those sorts of things. We're not going to have all the answers today, but we're going to point you in the right direction to find answers. Some of these are jurisdiction specific. But one of the things that we can do, so if you'll remember, step 3 is respond. So if someone did work while they were ill, we need to respond. And what that response is going to look like will depend on the type of work they did and the illness. So for example, if we're going to take hepatitis A, for example, if there was a worker who worked while they were ill with hepatitis A or during their infectious period, then we would have a different response than if it were a different disease. There's opportunity for providing prophylaxis so other people don't get sick. There's opportunity to provide a notice to the community that they may have been exposed and they can get some intervention. So there are some things that we can do. Other times what we can do if we find out they did work while they were infectious is just do a really good, to determine whether or not other people were also ill. That'll give us an idea. We can do some case finding. We'll be able to find out if there's additional cases, but also find out if maybe we can determine the source of this person's illness. Maybe they shared a source. And then the other thing we're going to do is, for example, if this is in a child care facility, this will provide us an opportunity to give guidance to the facility about what to look for additional cases and what to do about it. So that's our step 3, respond. And then I want to talk about exclude. Again, the exclusion criteria are written in the Arizona Administrative Code. And I'm going to share my screen with you right now. Let's see if I can get this to work. So what you're looking at here is a summary of what's written in the Arizona Administrative Code. So this is just a summary of all of the diseases that exclude for food handling, childcare, and healthcare. This is only enteric diseases, and it's not even all enteric diseases. It's just a summary of those that have food handling exclusions and some other exclusions. And you can see what I've done here is I've just summarized that for amoebiasis, the law states that a case or a suspect case with diarrhea needs to be excluded from food handling, childcare, healthcare, and then also using an aquatic venue. And then here it very clearly says until when. So for amoebiasis, there's 2 ways that can be cleared from food handling, childcare, and healthcare. It's either treatment with an amoebicide and a stool specimen is negative for an amoeba, or number 2, a local health agency has determined that the case or suspect case is unlikely to infect other individuals. And then to just show this, finish up this example for amoebiasis, the person is excluded from using an aquatic venue for 2 weeks after diarrhea has resolved. So hopefully this handy little tool will make it easy for you to just very quickly see what these exclusion criteria are. And I can share this with everyone. You can see the different diseases that are listed here. There's a couple of diseases that are a little more complex. For example, cholera. No, that's not the example I wanted. Hepatitis A, you can see that there's exclusions for a case or a suspect case, but there's also exclusions for a contact that has symptoms of hepatitis A, and there's exclusions for contact, well, not exactly exclusions, but there's public health response for a contact who's a food handler without symptoms of hepatitis A, and that public health response is to monitor that person for symptoms for 45 calendar days. So. And then typhoid fever has exclusions for a case or a suspect case, exclusions for a carrier, and then also exclusions for a contact. I will also note that there are some food handling exclusions for some non-enteric diseases that you might keep in mind. Diphtheria, not that we see a lot of that, but diphtheria does have exclusion for food handling, and also group A strep, strep throat. And then this next one is a grid that summarizes what was above, and it's just all of these diseases in a grid format that says, you know, whether or not there is case exclusion, case or suspect exclusions, whether or not there's contact exclusions, contact monitoring, and then carrier exclusions. And then the last 4 columns show whether or not there's food handling exclusions, child care exclusions, healthcare exclusions, and aquatic venue exclusions. So we recently updated the code, and as we were doing so, we looked really carefully at each of these diseases to make sure that we were excluding only when necessary, and then we also updated the way that a person can be released from exclusion. And then this last one is the same diseases, but showing the time frame for exclusion. Again, this is just an overview, so this would just kind of give you an idea. You'd need to look at the specific language to see this more specifically when you're actually taking action. But here you can see which group is excluded, and then how long they need to be excluded: until treatment is initiated, until there's a negative stool test, until cleared by the local health agency, until diarrhea is resolved, etc. So I hope this will be helpful for you. Okay, I'm gonna stop sharing. I hope this will be helpful for investigators as they're working on this step 4, which is exclude, and then also help guide you as you're providing education for them. Okay, so just to summarize what we've gone over, one part of our enteric disease investigation and response is to identify sensitive occupations and to respond to those. And the 5 steps for that are to identify sensitive occupations by asking good questions, determine if the person worked while infectious, respond if they did work while infectious using tools and resources available to you, excluding individuals from further work during if they are infectious, and then providing education about that sensitive occupation. All right, I'm looking at the time here and wanted to make sure that we have time for open discussion, but we also have more on the agenda. But one piece of, so there'll be some open discussion here in a minute if there's more questions or things. But I did also want to say that through each session, we're going to be providing some guidance about, or some tips and tricks about a part of the MedSys DSO. So for those of you that are MedSys users, hopefully we'll be able to give a little tidbit of tips and tricks. And today, what that is we're going to be talking about tips and tricks for using the new case contacted and interviews table. So this is kind of a new portion of MedSys that shows what interviews have been attempted and which interviews have been completed. And it gives us an opportunity to notice when there's gaps that maybe we can help fill, and then also provide us a way to monitor our timeliness as a state. So if it's okay, Caitlin, if we want to maybe move on to the case investigation, and then I can pull that up if we have time and do a little walkthrough of that.
Mary Lee, I'm sorry, you actually had a question that came through the chat. Lisa had asked for Hep A, does vaccination status change exclusion time?
I actually suggested to Lisa that she'd bring that up during the discussion time.
Oh, perfect.
I wanted a little more clarification, but I just did it via message, so we'll go over that in a little bit. I think probably would be a better time.
Okay.
Okay, so we're going to move on to the next portion of today's session, which is my favorite, is the case investigation summary. And Martha has so kindly offered to share her experience with us. So we'll hear from Martha, discuss her case, and then with the time left over, we will go into some of these questions that have come through the chat box, and then we also have some open discussion questions we'd like to pose to you all. So Martha, if you want to go ahead and tell the group a little bit about your case and what made it interesting, difficult, and how you addressed it. Martha, you're still on mute.
Thank you. So this case was investigated last month, February 20th. And so I'll just give you guys some background. So it is a 56-year-old female, and it said that she was positive for Campylobacter. And so what I did is I called her, and when I first contacted her, she answered the phone, which I was happy about. But then she said, can you call me back at a different time? This is not a good time. So I said, sure, I'll give you a call tomorrow. And I went and called her again. And the second time I called her, she answered the phone. And it was really, really noisy in the background. I guess her husband is in a band. And but she stepped away, and so I was able to hear her a lot better, and she was able to hear me. So that was good. What made this a little difficult was she's 56 years old, so she's not like 96 years old or anything like that. But it was kind of hard to understand her because of the speech. It wasn't very clear, for one. She would go off on tangents, and so I had to kind of like redirect her back to the questions. And it was also difficult to get a food history because she didn't have a very good recollection of what she ate. But I did, I was able to obtain that she said that she was on a diet, and so that she has just been eating carrots, lettuce, salads, and she mentioned two interesting things. She mentioned making chicken, and that her husband didn't want to eat the chicken because he said it wasn't cooked thoroughly. And what she mentioned was that her husband only eats chicken if it's like burnt, like really crispy. And to her, the chicken was cooked all the way. Anyways, the husband didn't end up eating the chicken. She ate the chicken. So that could have been the reason why she would have gotten sick. But also she mentioned that since she had been on this diet, the only thing that she ate that was different was cheese sticks and a cheesecake from Walmart. and she made it seem like she ate a lot of it. And so I was like, okay, that's interesting. That might have caused her to get sick, but I don't know if it might have caused her to get Campylobacter. Anyways, so that was it. Any question?
Well, Martha, do you have any questions for the group that maybe we could answer about what made this challenging or interesting? Something that you wish you would have known?
Well, looking back, I wish that I would have asked her if her husband ate the cheesecake and the cheese sticks, because that would have kind of, if he did and he didn't get sick, then that would probably rule out. And my other question was, I mean, is the risk high for her to get sick from eating those items that were store-bought?
Well, I think pasteurized cheese products are very low risk of transmitting Campylobacter, and same with the cheesecake, probably made with pasteurized products. One way that would make an exception to that is maybe if a food handler at the store that was preparing the cheesecake might have been sick. It probably could have been contaminated that way. I think those are probably lower risk food items, but it sounds like this is super challenging with lots of noise in the background and, lots going on. And, it can just be a challenge just getting through the interview sometimes. And then on top of it, piecing through what might or might not be important. And I think what I've heard Mackenzie say lots of times is just write everything. We don't know for sure. And, one of our jobs as investigators isn't to piece out what is or isn't important, but just putting everything down on the form. That can be incredibly helpful. After we have several cases of the same disease, we can look back and see what commonalities they had.
Yeah, well, that kind of, I guess it makes the pressure less. It makes me feel like I don't have to find exactly what it was that made her sick. But yeah, you're right, writing everything down. That way you can see if there's anything common.
And Martha, I do just want to comment. I know you said you sometimes feel that pressure to figure out what's made them sick. And I often tell most of my cases that it's so hard to know where you got this bacteria from, because you can get it from so many different places. And a lot of times for investigators, it's really frustrating because we want to be able to figure out, where our case got this bacteria from. But I always find it a little bit more reassuring for cases when they hear how common it is. And I say it's kind of like a double-edged sword. Yes, we really want to figure out where you got this bacteria from, but also in order to do that, we kind of need a lot more people to become ill, and we don't really want that. So it's just, I think, letting them know that it is common, it is out there, and just the best they can, or the best thing they can do for themselves is proper hygiene. That seems to be pretty reassuring, and it takes a lot of pressure off of yourself and the case as well.
I have a question about in MedSys, if there's a question that asks how the source or how the case likely got sick. So it'll ask if it was environmental, food, water. So usually for safer, if they were in Mexico and had bad food and were sick, a couple of days later, I'll put food. But is that something we should only fill in if we're, well, you can't be sure, but if we have a strong gut feeling, or if we have no idea, is it okay to leave that field blank?
So I think this also maybe goes back to jurisdiction. I personally am not a fan of that question because, again, you just never really know where this person may or may not have gotten their bacteria from. So, and again, I don't want to speak for every jurisdiction, but here at ADHS, I often leave that portion blank. So it's maybe something you might want to check with Maricopa on if they have a strong feeling on that. And it's the same for every other county that is here today.
Okay, thank you.
Of course. Any other questions before we maybe move on to some open discussion? Okay. I'm not seeing any, so we can go ahead and jump to Lisa's question that she had for Mary Lee. And again, that was just for Hep A, does vaccination status change exclusion time?
Okay, so clarification, Lisa, do you mean if the person who's sick with hepatitis A is vaccinated? Oh, you're still on mute.
There we go. Now can you hear me?
Yeah.
It's usually where, not the case that's vaccinated, but the contacts are vaccinated, whether they're in a daycare center or they're a food service worker. And you have to exclude them for that watch period or whatever. If somebody's vaccinated, does that change how long you keep an eye on them? Is that the 45 days or?
So, looking at what the Arizona Administrative Code says is that, you know, a case or suspect case has exclusion. A contact with symptoms has exclusion, and then a contact without symptoms that's a food handler would have a monitor status. So I think in that sort of situation, you know, if the contact that's a food handler that doesn't have symptoms is vaccinated, the chance that that person's going to get sick with hepatitis A is really quite low. It's a really great vaccine that works really well. And your jurisdiction may decide that the monitor isn't necessary. Do people have other thoughts?
I would say the same thing, Mary Lee. If they're asymptomatic, I wouldn't exclude them. And like you said, it's unlikely that they would develop the illness, but it's always a good idea to always have people keeping an eye on things. Even with enterics, you know, I usually just say, well, okay, I'm glad to hear that everyone's well now, but if for some reason they are to develop symptoms and I give them the time frame, be very suspicious that it could be this illness. Because it's transmissible, you know, through what route it may be.
Yeah, this is Benito. I have a question on the. I'm not sure on the asymptomatic or the symptomatic. Do you recommend, what would be a recommendation to provide immune globulin plus the vaccine, because of the the vaccine will take, like, you know, we know about 2 weeks to, you know, to develop antibodies and all those things. So will that be something that you may suggest? The reason why I'm saying this, because a long time ago we had some situation right here that we provide immune globulin plus the vaccine in some cases. So I don't know if that will be kind of standard thing or just case by case. I presume probably case by case, but I'd like to hear from you.
You know, this is a really good point, Benito, and it's a challenge not just for us, but also nationally. Part of the challenge with hepatitis A is that the dose for IG has gone up quite a bit, and that's because the natural immunity in plasma is less available. So in order to get the dosage that we need, it's just getting to be cost prohibitive for a lot of people. So I think if we do hit this situation, we'll review what resources are available, what recommendations are available, and we'll talk about what is available. Vaccine seems to be the best way to go for most people, even as long as it's following those guidelines. Others that have thoughts, speak up. Let's hear from others. Okay, we have a question in the chat box. If someone has hepatitis A, can they still get vaccinated, and would it be effective as far as reinfection occurs? And Mackenzie's answer is that once someone has had hepatitis A infection, they are immune for life. We have a lot of resources about hepatitis A that we are happy to share. And Mackenzie, do we have a how-to coming up about hepatitis A?
We already did it, but we can send the slides and that should help.
Yeah, hepatitis A is one of the most tricky diseases. We had this, some slides about hepatitis A we can share with everyone, and we can continue to chat about it too if specific questions come up.
So the food team will make sure to send out those Hep A resources. I do have a question more along the lines of the theme of today's session, but again, if you do have more questions about Hep A, please feel free to ask them in the chat box or just raise your hand. But my question for you guys is, how do you handle a person who is unwilling to talk to you about their work in an interview? I've personally never had this pushback before, but I've definitely heard about it. So can anyone in the group speak to their experience?
So I can talk about, oh, no, someone go ahead. Whoever was talking, go ahead, please.
Debbie, I've never had that experience as far as someone refusing to talk about their work, but I had someone that he was concerned about people knowing him and what his disease was. And then I give them my number and they can call me back just to make sure I'm that person. You know what I'm saying? You know how people call and they're like, oh God, how do I know it's the health department? And just for like HIPAA or to make them feel at ease, I give them my work number and have them call me.
Yeah, that's a very great strategy. I know that we've definitely used that one before as well. And it definitely helps ease the case and allows them to talk more freely about their diagnosis. Maricopa, did you want to speak to somebody maybe pushing back about talking about their work?
Sorry, I was going to type it. I will typically ask about their work or childcare in the beginning while verifying the demographic information, and then talk about the exclusion and the importance of reminding them about their
You cut in and out a little bit, but I think I heard the gist of it. Did you say you usually verify the occupation when you're going over demographics? I'm seeing a nod. That's I've never heard that strategy before, but that's a new one. I do like that. So for Maricopa, they say they typically ask in the beginning for occupation while verifying the demographic info, and then talk about exclusion during the education at the end of the interview, which makes sense. You want them to answer all your questions before you have to talk about exclusion. Does anyone else have any other experience with pushback when talking about work?
This is along the lines of what everyone has already said, but I just tried to make them feel comfortable and assure them that you know, I'm not here to take their job away. You know, they get really scared. It's only happened once, but, you know, the person I was talking to was scared, thought I was going to, like, call their manager and, like, get them fired. So I just try to calm them down and explain why it's important that we exclude him to make sure that he didn't get other people sick, and let him know that the information was completely confidential, that this wasn't going to get out there, you know, emphasizing HIPAA. And eventually I was able to make him feel comfortable, and he was willing to open up and share the information because I reassured him that I guess he wasn't going to get in trouble and that his information wasn't going to be out and about and everyone was going to know what he had. So just kind of talking him through that, I think, helped a lot, and eventually he opened up.
Perfect. Thank you, Jenny. And that kind of leads to one more question I want to pose to the group before we wrap up for the day. How or what are the rules in terms of speaking to someone's manager that we do need to exclude? Has anyone ever had to reach out to either a food handler's manager or reach out to daycare?
That's a good question. I had a very similar question because at that point, aren't you kind of letting the manager know that one of his employees is sick? And what if he does get fired? He or she gets fired because the manager doesn't want to, or maybe wanted to fire this person and was just waiting for a reason to do it, and this is the reason. You know what I mean? You can't promise anybody that they're not gonna get fired or get in trouble, especially if you have to notify their manager because they worked while they were infectious, right? I've never had to do that, but I'm just saying I could see a situation like that occurring.
I have had that experience, Martha, when I was working at the county in Florida. There are a couple of thoughts on it. The first is it's always a good idea to have a suggestion for the manager. So if someone is sick with salmonella in their food handler, they could probably safely work the cash register as long as everyone's aware and there's lots of hand washing and that they're no longer symptomatic. So I like to give the manager an alternate idea. I did have a situation where I believe they got fired. But I want to tell you that the great thing about the new rules is that I think that will be really reduced because they can basically return with no longer having diarrhea, with a stool test, which hopefully a rapid test will be really fast for them, or if the local jurisdiction deems them no longer infectious. So I think explaining to the manager what's going on and why it's important and suggesting other ideas is the best way, and then making sure that everyone feels like you're really on their team, because people can get kind of defensive and why are you making me do this? So it takes a little persuasion and letting them know that, like, I'm here, I want to get you back to work as fast as possible. But it unfortunately can happen.
Thank you.
You not going to lunch today? I'm on this stupid meeting.
Okay, I have a comment about, one of the situations that we have as a county border is a lot of people goes to the other side of the country. They go to Mexico and they bring a prescription or a diagnosis. A lot of the times for salmonella, which is not salmonella culture, is a serology. And sometimes, they don't let their managers or anyone else know about, their symptoms. So that is one of the situations. And sometimes, it's really hard for us to how to handle those situations. So that is just a common. And I don't know what happened with the other border counties, probably the same.
Thank you all. Well, I really do want to be respectful of everyone's time today, and we're coming up on the noon mark. So I just wrap up. We will go ahead and send out information about Hep A, and then Marilee will send out some of those exclusion tables that she also showed to provide some guidance for everyone. And then if you, again, could please email your investigation form back to the food team, that would be so greatly appreciated. And we will see you guys next Tuesday for a rare disease spotlight on Vibrio. Thank you.
Thank you.
Thank you.
Bye, everybody.
Thank you. Bye.